Hi, I'm Lucas with the Nurses Think Tank.
Hi, I'm Milan with the Nurses Think Tank, here to talk to you about the Affordable Care Act, also known as Obamacare, also known as the Patient Protection and Affordable Care Act. This is a popular graphic illustrating the law's simplicity. I know, right? To make things easier, we'll try to discuss this law in parts. The first is ACA 101, the basics.
The Affordable Care Act is the name of the American healthcare reform law enacted in 2010. Before this bill, American healthcare costs were in a steep upward spiral. Unpaid medical bills were the #1 cause of bankruptcy nationwide, and the number of uninsured Americans was climbing.
Politicians were beginning to accept that change in some form was unavoidable. The Affordable Care Act was that change, and its two-part goal was to increase healthcare coverage and reduce healthcare cost.
The Affordable Care Act made many significant reforms to the American healthcare system. These changes, described as the three-legged stool, were the individual mandate, elimination of pre-existing conditions and elimination of lifetime caps, or guaranteed issue, and government subsidies to help pay for the coverage. The individual mandate. This mandate stated that every person in America was required to obtain health insurance coverage or pay an annual fee. Also, the ACA mandated that all employers now had to pay for their workers' health insurance. The individual mandate, like the rest of the ACA, did not apply to undocumented immigrants. They were not eligible for any part of the ACA.
Guaranteed issue is the part of the ACA that prohibits insurance companies from denying people insurance for pre-existing conditions or charging more based on those conditions. An example scenario would be if a person with asthma were to try to buy insurance. Before the ACA, insurance companies could deny them coverage or offer wildly expensive coverage because asthma is considered a pre-existing condition. Because this was common practice for insurance companies, many people would simply stop seeking health insurance altogether and wind up owing huge medical bills when they inevitably became sick or injured.
Subsidies. The federal government, with financial contributions from state governments, helped those who couldn't afford insurance or who did not get their insurance through their jobs by offering discounts known as subsidies. This happened mainly through an expansion of Medicaid, the federal government's program that pays for health care for people living under the poverty line. The expansion of Medicaid raised that line to 138% area median income, or an annual income of about $15,800 for individuals. The American healthcare insurance system can be thought of as a giant bowl that everyone puts recurring amounts of money into, so that when you need an expensive procedure, there's enough money available to you and everyone else who has been contributing. This is important because you never know when or how much you'll need. Without insurance, each person would be responsible for their own medical bills. Most people cannot pay out of pocket for their health care, and this kind of system has been shown to cause people to delay care. It is significantly cheaper and creates better health outcomes to create a system of guaranteed health coverage and preventative care across the board.
The key to the ACA's success or failure was that each leg of the stool only works if the others are in place too. The individual mandate adds a lot of money to the pot used to pay for health care, stool leg number 1, which allows insurance companies to provide coverage for people with expensive pre-existing conditions, stool leg number 2. And the additional government subsidies for poor and middle-class people allow those mandated to buy insurance a way to afford it, stool leg number 3.
The individual mandate made it so millions of younger, healthier people put money into the giant bowl. And since they are not sick as often, they take less out. That way, the older, less healthy people are now able to have their more frequent, more expensive care provided affordably. The bowl will continue to be filled by everyone, and funds will be available to those who are younger and healthier now when they need it later on in their lives.
To make sure the insurance the government is requiring its citizens to obtain is actually beneficial to us, the ACA ensures all plans now have to cover the 10 essential health benefits. These are ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, and pediatric services, including oral and vision care.
Arguably, preventative services are the most important of the 10 essential benefits. These include cancer screenings, immunizations, and routine checkup services, among many, many others. By making these part of every insurance plan, the ACA was taking the first steps toward reducing the growing cost of healthcare.
Preventative care keeps people from entering the healthcare system through the ER, which is by far the most costly entry point. According to the CDC, the cost of emergency room care for the uninsured is a staggering $10 billion a year. This cost gets shifted to your health insurance premiums and to Medicaid. Prevention is a way to dramatically lower healthcare costs while promoting healthy living rather than costly emergency treatment.
The ACA is a bold experiment to address the out-of-control costs of healthcare in our country. Healthcare in America is unique and complex, and any attempt to improve it is an incredibly difficult undertaking. While many of the ACA's changes have improved the health of Americans, the law has faced several shortcomings that need to be addressed.
The ACA is the landmark legislation of our generation and has become part of the current political divide we see today. There are many challenges ahead for American healthcare: an aging workforce, automation, and the effects of climate change, to name a few. Whether we decide to keep the ACA, start over, or return to the pre-ACA system is very much unknown at this time.